Good day, everyone. Hi, it's me again, Nurse May, and today's return demonstration, I'll be showing you on how to get your body temperature, your pulse rate, your respiration rate, and of course, your blood pressure. So the first thing that we are going to do is of course to assemble our equipments. So we have here our sphygmomanometer, a cleansing wipes, some cotton balls, of course, a box of disposable clean gloves, a lubricating jelly for rectal temperature, alcohol for sanitizing, digital thermometer, a watch, of course, our stethoscope, and a ball pen in documenting our findings. After doing the second steps, of course, we are going to sanitize our hands. Put some gloves if necessary. Provide some privacy to the patient. It's either close the door or close the curtains. Then we are going to introduce, of course, ourselves to the patient or the client. Good day, ma'am. Good day, patient 1. Today I'll be taking your temperature rate. The next step that we are going to do is, of course, to place the thermometer. By the way, there are 5 different ways in getting a patient or client's temperature rate. The first one is, of course, the oral, from the mouth. Then we have the temporal, or in the forehead. Then we also have the axillary, of course, in the armpit. Then we also have the rectal in the anus, and the tympanic, of course, in the ear canal. So today, since I only have a digital thermometer, we'll be using the axillary way of getting the patient temperature rate. The next step that we are going to do is, of course, to roll up the client's sleeves, so it will be easier for us to place the thermometer. By the way, first we are going to pat the client's underarm or armpit to make sure that it is dry and not moist. Make sure that the thermometer or the bulb of the thermometer is in the center of the client's armpit. Then we are going to wait. After waiting, we are going to take out the thermometers. The body temperature of the patient is 36.2. The next thing we are going to do is, of course, to record it. This is, of course, for the purpose of accuracy and prompt. So we will not forget it. We need to record it directly. Then the next thing we are going to do is, of course, to take off our gloves and sanitize, and of course to take some sanitizing or cleansing wipes and sanitize the thermometer. Next thing that we are going to do is to take the pulse rate of the patient or the client. So just like what we did in taking the temperature rate, we are going to first introduce ourselves. Of course, this is to promote cooperation. Explain what we are going to do so that the client or the patient will understand, and it reduce or minimize anxiety. Perform, of course, a hand hygiene. It's either to wash our hands or to put some alcohol. Then provide clients privacy, of course. Then the next thing we are going to do to place our index finger and our middle finger on the inner aspect of client's wrist over the radial artery and apply light but firm pressure until pulse is palpated. Then, identify pulse rhythm and pulse volume. Since the client's pulse rhythm and pulse volume is regular, we are now going to start to count the pulse rate by using the second hand of watch in 1 full minute. After counting the pulse rate in a full minute, in a 1 full minute, we are going now to document the pulse rate, of course. And that is the last step of assessing the client's pulse rate. Now, we are going to assess the patient's apical pulse. By the way, in assessing the patient's apical pulse, I'll be using a new, I mean, I'll be assessing a new patient, which is patient 2. And while doing, before doing the procedure, of course, we must first do a hand hygiene. We must first wash our hands, of course, introduce ourselves, then tell the patient, verify the patient, of course, and give some privacy to the patient. It's either close the door or close the curtains. In assessing our patient's apical pulse, of course, we'll be using a stethoscope, but before anything else, we make sure to cleanse the earpiece and the diaphragm of the stethoscope with an alcohol swab. But since I don't have any alcohol swab, I'll be using a cotton ball with alcohol and, of course, a cleansing wipes. This is for the purpose of reducing transmission of microbes. After cleansing the stethoscope, we are now going to raise the client's gown to expose the sternum and the left side of the heart. Then locate the apex of heart. Now,
Place stethoscope at the fifth ICS in order to hear PMI. Inform client to remain silent and make sure that the stethoscope is warm. Place the diaphragm of the stethoscope over the PMI and oscillate for the sound 1 and sound 2, or the S1 or S2. Start to count while looking at the second hand of the watch. Share your findings with client and of course record your findings. The next step that we are going to do is to get the respiration rate of the client. So just like what we did in the temperature, getting the temperature rate of the client, we are of course going to introduce ourselves. We are going to verify the client's identity. We are going to explain what we are going to do to promote cooperation and to minimize anxiety, of course. Then perform hand hygiene. It's either wash your hands or sanitize. Then provide for clients' privacy. Close the door or close the curtains. Then we are going to place the client's hand or our arm across the chest of the client. It's either our hand or the client's hand. This is to observe the chest movement. Placing the client's arm across the chest allow us to determine the respiration or the respiratory cycle. Since our client is in a supine position, we are going now to start our first count in the inspiration while looking at the second hand of a watch. Then we are going to observe character of respiration. If it's deep, the rhythm, then of course observe the character of the respiration, the sound, if it's normal or interrupted, if it's shallow or normal or deep. After counting the client's respiration rate, we are now going to record the respiration rate of the client and of course wash our hands. This is to prevent transmission of microbes. The next thing that we are going to do is to take the blood pressure of the client. So just like what we did, we are going to introduce ourselves, clarify or verify the client, and of course we are going to tell her what we are going to do. This is to promote, of course, cooperation and to minimize anxiety. And of course, we are going to provide the client her privacy. We're going to close the door or close the curtains. Then we are going to position her in a appropriate position. It's either in a supine or a sitting position. So now our client is in a sitting position. Now we are going to expose or flex the upper arm of the client. We're going to roll the sleeves. Then we are going to put the cuff. Making sure that the cuff is fully deflated. Then we are going to locate the bronchi artery using our fingertips. After
after placing the deflated cuff, make sure that the valve is closed and the manometer is facing you, so it's easier for you to locate, or it's easier for you to see. The next thing we are going to do is to put on our stethoscope. Make sure that the earpiece is clean before using. Place the bell on the artery, and we are now going to start to inflate the cuff. After inflating, we are now going to slowly release the air in the valve. After doing that, tell the client or read the findings to the client, then we are going to record it. Patient 1, your blood pressure is 130/80.
After getting the blood pressure of our patient, of course, we are going to cleanse our stethoscope and blood pressure using a cleansing wipes and a cotton balls, and of course a alcohol. This is for the purpose, of course, of reducing or preventing transmission of microbes.